Meanwhile, according to the weekly epidemiological report 32, Nigeria recorded more cases from previous week and more cases discharged. However, one death was registered and the case fatality rate dropped to 1.2%. Mrs. Elsie Laurie is the NCDC head of Disease Surveillance Department. She joins us now to take a look at the virus trajectory in the country. Thank you for joining us on the program.
Thank you for having me. It's good to be here.
All right. I'd like us to begin, and this is before we talk about the last situation report, what we're seeing, especially the report from last night, the 203 new cases, quite a jump from the a little over 30 that we had the previous day, and then we're also seeing 28 deaths in a single day.
Yes, that's quite unfortunate, but these cases are actually backlogs from previous weeks. We worked with the states because we noticed that some states have not been reporting. And so we called the states and we meet with the states regularly, but sometimes you find out that some states have, relaxed in terms of reporting. And so we had a meeting with the state and told them to look at their data and please give us the actual report. So yesterday's report was actually a backlog of some weeks since February, especially for Nasarawa. Nasarawa recorded, they did not give us a record of their deaths. They kept recording the cases. And unfortunately, we found out that the case managers where the cases were being managed, and when their deaths recorded, they were not related to the state epidemiology. So we had that gap, but we're working on that gap now to make sure that we do not have this kind of situation in our hands. But of course, we have to report it, and so that's what we have done. And the same thing goes for Benue State. Thank you.
So in terms of the monitoring, the surveillance, I mean, the NCDC has always said that states are responsible for this, for driving the awareness, for contact tracing, for testing. Are you saying that not much is being done at the subnational levels?
Not as we will expect them to do. A lot of states are doing very well. We have Lagos State doing very well and reporting all their cases and the deaths that they have recorded. But there are some states that are actually a little slow in catching up. And so such states, we monitor them regularly. If you remember at the beginning of the outbreak, we sent our teams to states to help to support the states in the response. So we've done that regularly. But of course, like you mentioned earlier, it's the responsibility of the states to do the active search for cases, do the testing, and also do the contact tracing. So, but we monitor them at the national level regularly. Thank you.
Finally, following the NCDC's last epidemiological reports, are we doing better in terms of controlling the pandemic?
Well, with the people not responding to the non-pharmaceutical interventions that are in place, well, we will say we are doing very well in quotes, but we need to be very careful because we have people coming in from some countries that have very high incidence and deaths, and they also have this variant of concern. And so we need to make sure that we take the necessary measures. We need to put the necessary measures in place. We need to protect ourselves. We need to take more responsibility. Looking at the cases, we know that other countries like India, there was a time we were praising India that they were doing very well, and suddenly they had events that blew up the number of cases for them. So we need to be very careful. So yes, we will say we're trying our best, but I'm not sure we're doing very well in terms of taking responsibility. And that's very key because each person needs to take responsibility. And what are these things? Put on your face mask when you're going out, especially when you're in crowded places. Make sure that you have this social distancing between yourself and the next person, about 2 meters. wash your hands regularly. Use the sanitizer when there's no running tap available. So we need to do that for ourselves and take responsibility. Thank you.
Thank you, Mr. Zelsi Laurie, NCDC Head of Disease Surveillance Department. Thank you for joining us on the program.
Thank you for having me.